Most gynecological procedures are performed with the patient in the supine or lithotomy position. During procedures on the vulva or done vaginally, the patient will be in lithotomy position. This positioning puts the surgical technologist in an awkward position, with a back table placed at the foot of the patient, behind the surgeon, or at the side. This requires the surgical technologist to either reach across the front of the surgeon and assistants or pass instruments between them. Neither option is satisfactory, but must be used to preserve aseptic technique. Vulvar surgery is surgery on the external female genitalia. Conyloma is also known as genital warts. This can be removed by laser, bovie, cryotherapy, or excision. No matter what method is used for removal, the smoke evacuator should always be used. If using the laser, then all the typical laser precautions such as eye protection and wet towels should be utilized. Wet towels are used to drape the patient for protection, and no paper products should be used. The wet towels will absorb the laser beam. Acetic acid, which is vinegar, 3 to 5% concentration, can be used on the surgical site. This makes the diseased tissue stand out and give the surgeon better visibility of the lesions. After surgery, the surgeon will apply Silvadine cream, which is an antibacterial. It looks like a white, thick paste. Surgical excision of the labia, clitoris, inguinal, and pelvic lymph nodes are performed to treat cancer of the vulva. Vulvectomies may be performed as a simple or radical procedure. During a simple vulvectomy, only the lesion itself and a small margin surrounding it are removed. The specimen is examined for clear margins and no further surgery is indicated unless there is extensive involvement. Radical vulvectomy is a complex procedure involving groin exploration, lymph node removal, and wide resection of the lesion and adjacent tissues. Here's an example of stage 4 cancer that has been treated by a radical vulvectomy. Many surgical team members believe that vaginal procedures are contaminated or dirty cases. This leads to poor aseptic technique because the staff members do not feel compelled to exercise care. Any pathogenic bacteria can cause an infection, including bacteria from sources on objects, in the air, and on dust particles. The vestibule, uterus, cervix, and any other perineal structure is not immune to bacterial invasion. Consider a scenario in which an antibiotic-resistant Staphylococcus aureus bacteria, or MRSA, is transferred to a patient's cervix by direct contact with a contaminated glove during surgery. You don't want this to happen to your patient, so always practice your best aseptic technique. Vaginal surgery is surgery on the vagina or surgery on the cervix that is approached through the vagina. Reconstruction of the vaginal wall is called chloroporaphy. This type of procedure is done to treat a sistersteel, rectosteel, and less commonly an intersteel. A sistersteel is when the bladder protrudes or herniates into the anterior vaginal wall. A cystocele is when the bladder protrudes or herniates into the anterior vaginal wall. A rectocele is when the rectum protrudes into the posterior vaginal wall, and an interstitial is when bowel, usually the small intestines, herniates into a weakened area between the anterior and posterior vaginal walls. The pelvic floor provides support to the intestines and genitourinary structures, especially during pregnancy when gravity pulls the fetus downward and stretches the ligaments and muscles. As the pelvic floor becomes weakened, the bladder and rectum can bulge into the vaginal canal. Repairing a cystocele is called anterior repair, and repairing a rectocele is called posterior repair. These procedures are often done at the same time. This is an anterior and posterior repair, or an AMP repair. This procedure is often done at the same time as vaginal hysterectomies. The surgical technologist will need many Alice clamps available for the A&P repair. Vesico-vaginal fistulas is a small hollow tract that connects a bladder to the vagina. A recto-vaginal fistula is a tract between the rectum and the vagina. A uterovaginal fistula is the communication between the distal uterus and the vagina. All these fistulas can be surgically repaired. Retropubic and transobuturator suburethral tape has become a common surgical treatment for stress urinary incontinence, which is leakage of the urine when coughing, sneezing, laughing, jumping, walking, sitting, or standing. TVT, or transvaginal taping, is a surgical procedure in which the urinary bladder and urethra are repaired, strengthened, and returned to normal position within the pelvis. The tape is considered an implant and should be touched as little as possible with gloved hands. A D&C is a dilation and curettage, and D&E is a dilation and evacuation, also called a D&C with suction. In this procedure, sharp and smooth curettes are used to remove the surface of the endometrium through the transvaginal approach. This procedure is used for diagnostic and therapeutic reasons. A D&C is used to diagnose and treat abnormal uterine bleeding, such as menorrhagia, which is excessive uterine bleeding, and dysmenorrhea, which is painful menstruation, and to remove endometrial polyps. The D&E, or D&C with suction, is to the D&E, or D&C with suction, is used to remove retained placenta or incomplete or missed abortions. The D&C has a basic setup in the order of use. This is speculum tenaculum, sound, dilators, cervical curettes, uterine curettes, a spoon, telfa, and sponge stick. Pratt, Hank, or Hagar dilators are used to dilate the cervix, and curettes are used to remove cervical and endometrial tissue. The endometrial tissue is obtained for biopsy for diagnosis and or to control uterine bleeding. If a fractional D&C is done, the specimens are endocervical curettings and endometrial curettings. This will be set on telfa separately. If suction is used, the machine would look similar to this one. The curettes that are used are plastic, and the specimen will be labeled P or C, or products of conception.